Welcome to CONNECT-icut Health and Wellness Practitioners YouTube channel. In this video, we're going to learn how to relieve low back, hip, and leg referral pain through stretches, exercises, and myofascial release techniques. My name is L Besson. I'm a licensed massage therapist, a former personal trainer. I'm certified in yoga instruction and myofascial release techniques. I find it even more important that I have personal experience with chronic pain from sports injuries when I was younger. So first, a little anatomy. Here's the transverse abdominis muscle. This muscle wraps and attaches to the whole core of our bodies. It wraps from the spine all the way to the front. By engaging it, it acts like a back brace and also helps to stabilize the pelvis. You can strengthen this muscle just by pulling your belly button towards your spine during any activity and any exercise that I show you during this video. These are the muscles of our pelvic floor. This is a picture looking down at them. They also could be strengthened by engaging them during any exercise, stretch, or daily activity. When strengthened, these muscles help to stabilize the base of the spine and the pelvis to help relieve pain in your low back and hips. Here is the psoas major and the psoas minor muscles. You can see that the psoas major connects to the front of the spine down to the thigh bone and is known as one of the hip flexors. When this muscle is tight, it pulls on the spine, causing low back pain. Also, when laying down with your legs out straight and flat, this muscle pulls on the spine, and that's why you have low back pain when you're laying flat on your back. Here's a simple stretch that anyone can do that stretches the group of hip flexors, including the psoas major. You could always ask for assistance with somebody holding your foot up if you need it. To do this stretch correctly, hold your upper body up straight and pull in that transverse abdominis, holding your core. Pushing your hip forward, you should feel a stretch in the front of your hip. To intensify this stretch a little more on the psoas major, simply push your foot out from the midline of your body, rotating your thigh bone. Here's a more advanced stretch for your hip flexor group. It also includes stretching out the piriformis on the other leg. So the key to designing your own routine is to explore many different stretches and exercises to see which ones work for you the most efficiently. Here's the piriformis muscle. When this muscle is tight, it pulls on the sacrum, the base of the spine, which can put the spine at a compromised state, causing low back pain. Also, normally the sciatic nerve runs underneath the piriformis muscle, but occasionally in some individuals it runs straight through. In either case, if the piriformis muscle is compressing the sciatic nerve, it will cause a condition called piriformis syndrome, which can result in the same symptoms as sciatica. This is a modified stretch for your piriformis. Just be cautious not to hurt the knee on the leg that you are stretching. And let's not forget the hamstrings. They're at the back of our leg. When these muscles are tight, they pull on the pelvis, again, putting the pelvis and the base of the spine at a compromised functional state, causing low back pain. I'm going to trust that you have some stretches for these muscles, but if not, please let me know in the comments below. Moving on to the muscles that rotate the spine. These are the small muscles within the spine that rotate it, called the transversospinalis group. To stretch them effectively, slide your hips to one side, lining up your spine, and then do your low back stretch that you probably know already. This is the more well-known group of muscles that rotate the spine, called the erector spinae. Along with the quadratus lumborum, due to their attachments, they could either cause low back pain or hip pain when tight. To stretch these muscles, you can either do this stretch sitting or standing, holding on to something. This is an area that I find fascial restrictions on many of my clients, from under the arm down the side of the rib cage. Here's a more advanced stretch for the QL, the erector spinae, the muscles of the hip, and the fascia of this area. By stretching out all these areas and getting them into a more efficient functioning state, you can also take pressure off the knees. This stretch, though advanced, is very effective at stretching out the front of the hip and the fascia of the area. Be cautious not to torque the knee. And here's a simple lunge that you can add to any part of your day. By holding in your belly button to your spine and holding your pelvic floor tight, you can strengthen the whole area to support your low back and hips. So now we have to remember how much the fascial system, the fibrous connective tissue that runs throughout our whole bodies, plays on the functional state of the musculoskeletal system. You could watch our video above for more in-depth information on this subject. But for now, it is now known that it is not only tight muscles and weak muscles that cause pain. Fascial restrictions caused by emotional and physical trauma and our surgical procedures results in the random laying down of connective tissue, pulling and putting pressure on different areas of the body, causing pain in them. By finding and applying gentle but firm pressure, you can help the tissue actually transform and release the fascial restriction. I'm showing you here areas to search for fascial restrictions that could help relieve pain in your low back, your hips, leg referral pain, and even pain in your shoulders. Another area to search is the front of the pelvic area, the lower abdomen wall. The smaller ball may be too advanced for somebody starting off. The purple ball is the modified version. So with this video's goal of staying active in your lifestyle, activity helps to boost your mind, body, and spirit. So if you're down and life is hard, even if you get out for a stroll, that could be helpful on many levels.